Papua New Guinea currently has a total health workforce of 11,823, but the required number of health workers is 16,247. Of these, 526 are medical officers or doctors, which is over 300 short of the required 855 required. The 19 newly trained doctors from Divine Word University will add to the required total by the government.
526 doctors present in our country in the face of about 800 plus required, or if not more, compels us to ensure that we register all doctors trained in our country, and this bill is in the right space. Our country needs more doctors and more medical workers. In the face of COVID-19, in the face of potential disease and pandemic and endemics into the future, we need to train more doctors.
The amendment is to allow new Divine Word University doctor graduates or from other institutions to be registered and be able to do residency training and practice, in which the previous law only allowed University of Papua New Guinea graduates to do so. Section 4 of the Medical Registration Act 1980 is also amended to include a registered medical officer from the Faculty of Medicine of the Divine Word University who will represent its graduates. A medical doctor by profession and former Health Minister Sepuka Temu, in acknowledging the bill and supporting it, he requested for a few changes in the wordings of the law.
I personally don't believe that a medical practitioner from the Divine Word University should be specifically mentioned in a law. You should have a broad representation, not mention the Divine Word University medical practitioner. I think it's wrong in principle. So I would request that the House look at this and make an amendment on this one, because I don't think you need to name a practitioner from the Divine Word University to be on this very important board.
Sepuka also highlighted the need for more doctors in the country and urged the Minister for Public Service Joe Sungi to be able to have positions created for doctor graduates in the public service.
I would allude to the Minister for Public Service. In the olden days, when we knew how many graduates would be coming out from the medical school, the Department of Personnel Management established those positions. So no medical student graduating is waiting for positions to be created. That provision was removed. So I strongly suggest Minister for Health and Minister for Public Service, who understands, both of you understand the system, to create positions the year before they graduate.
Pomio MP Elias Kapavore acknowledged former Divine Word University President Farah Yan Zuba for his foresight in having the medical doctors program at Divine Word University, which has produced graduates now. Apart from Divine Word University, MP Kapavore also shared concerns for the University of Papua New Guinea's medical faculty.
For the government to continue to support the University of Papua New Guinea, especially under the School of Medicine and Health Sciences, to be a standalone entity, so they can focus to making their own arrangements, coming up with their own structures, so that they can become under the autonomy program, so they can concentrate and focus on many of the things that they want to do as a university in the future. In that regard, they can also improve and increase the number of medical students and other cadres of health workers coming out from the medical faculty.
Health Minister Jelta Wong, in tabling the bill, advised Parliament that following the amendment of the Medical Registration Act 1980, the National Department of Health will continue to work on the Health Practitioners Bill 2021. Dennis Orere, National EMTV News.